Ivy, and I'm a writer. I worked on a textual story about mental health in East Africa. Specifically, the angle of the story is the female activists pushing for Kenya's new mental health action plan. So the story, I collaborated with some illustrators and visualizers who helped me. So this is one of the drawings I got for that. I'll be mentioning quotes from the main character, who is Grace Wangari, living with bipolar disorder and ADHD. And she says, we think we should be okay all the time, you know, and it's not true. She's 29 years old. I put my data visualizations into this, and it shows Kenya, Tanzania, and Uganda for male and female, with the male suicide rates being higher than the female suicide rates per 100,000 in each of the East African countries. This is another illustration by Edna Tabu. Then Ken, who is one of the people I spoke to who was being supported by Grace. He's an engineer living with bipolar 2 disorder. And he says today it costs him 20,000 to 30,000 shillings every month to see his psychiatrist and his therapist, as well as buy his medications. Less than 5% of Kenya's health budget is dedicated to mental health care. Maybe I should mention some of the data I'm looking to possibly get later is how much Kenya spends on an individual, on the health of an individual. So this is the mental health workers per 100,000, which was a bit surprising because every expert I spoke to thought that Kenya would be doing the best, but it's actually the worst according to World Bank data. Also spoke to Leto, a clinical psychologist, who brought to my attention that substance abuse gives us a good picture of the mental health status of people. Among substance use disorders, alcohol use disorders are common and account for 25% of the burden. So I took this substance abuse rates in Kenya and made this is the bar graph from it. I think that it's interesting. I thought this was interesting because it's difficult to get data that says specifically that, you know, this is how much, you know, this is how many Kenyans have ADHD, for example. But to say that this substance abuse can also point to, you know, that was interesting, and I'd like to see how that has evolved over time also. Yeah, so this is a quote from Wangari, who says, I thought it was a nice quote because it talks about substance abuse in Kenya. So I give up and I become that person who is just like a zombie. I wake up in the morning, I literally dragged myself out of bed. So it got harder to get out of bed. And then I started engaging in more toxic activities, like, you know, drinking after work. And let me tell you, you find the bars are full and you're wondering, why is everyone in a bar? And the one question was, why are we living in just one place on Monday? It's not normal. So yeah, that's an indicator of substance abuse and mental health. Another illustration we have there. And then here we have Leto saying for outpatient or inpatient visitations, sometimes it's actually a mental health presenting with physical symptoms. Now you deal with my symptom, I have a headache, I have chest pain, I'm not sleeping, you give me meds, I go home, but the source of that problem, the stress, still remains, and I have to get into contact with mental health professionals to help me. Yeah, I think this is the graph on the number of mental health workers per 100,000 Kenyans, which shows this how few people are accessing mental health services when they need them. And this is a data point I got, even though it is estimated that up to 25% of outpatients and up to 40% of inpatients in health facilities suffer from mental health conditions. A study of health professionals in the country showed 91% had not participated in specific professional development regarding mental health in the last decade. Which brings Leto's quote, makes it very, very profound for me to think that, you know, even if you were to go to hospital, the health workers are not. Is that the time?
No, fine.
Okay, don't have capacity to necessarily support the patient. This is another illustration, and it was inspired by the idea of lack of access to mental health workers. Yeah, so mental health facilities in East Africa for the public mental hospitals are just 3 for Kenya, Uganda, and public hospitals dedicated only to mental health. 3, which are one in Kenya, Mathari, one in Uganda, Butabika, and then the third one called Mirema in Tanzania. So looking forward, I'd like to see if I can get data on occurrence of different diseases in Kenya. Income versus cost of living in Kenya. One of the experts I spoke to called Dr. Gishimo said a lot of people have to deal with meeting their basic needs. So if you say, let's focus on mental health, that's a cost implication. So are they willing? Do they have the resources to address that? I'm also interested in whether I can find a map of rehabilitation centers in Kenya specifically, and also whether they are increasing, whether people are getting more support on that front, and if possible, admission rates, money spent on health per person. I think I've mentioned that. And then a lot of the data I got was not getting to 2021. It was usually very old data, just because it's not an issue that has a lot of quantitative data. So I think I'd like to see if it's possible to, for example, find a recent report in the coming weeks that would be, for example, this suicide rates end at 2019, and yet in 2020 and 2021 is when Africa now saw the COVID-19 pandemic. And I think that would really affect what data we see here on this page, for example. That's the end of my presentation.